Hi everyone. Today we're diving into a topic that's crucial for our well-being. We're talking about brain tumors, what they are, how they develop, and why understanding them is so important. Yeah, it's the thing nobody really wants to think about, the kind of health concern that often gets pushed to the back of our minds, but really should. Ignoring potential health issues doesn't make them disappear. In fact, it can make them worse. They're essentially abnormal cell growths that occur within your brain, disrupting its normal function and potentially causing a range of symptoms. And catching them early, through regular checkups and being aware of your body, can truly make all the difference in treatment outcomes and overall prognosis. It's easy to brush off initial symptoms as just stress from work or daily life, or simply chalk it up to tiredness after a long week. But sometimes it's indicative of something more serious happening beneath the surface. Knowing the warning signs and being proactive about your health is a superpower. It empowers you to take control. So let's get into what specific symptoms you should watch for, what might be considered red flags, and most importantly, when it's time to seek professional medical advice and see a doctor. If you care about having real, open, and important health conversations that can make a difference in your life, hit that subscribe button down below. And with that said, let's dive right in and get started. Let's start with headaches, a common ailment that most of us experience from time to time. But what happens when a headache becomes more than just a passing discomfort? We're not talking about your usual stress or screen time headache, the kind that fades away with a break or some pain relievers. This is about a headache that's new, something you haven't felt before. It's persistent, sticking around day after day, refusing to let up. And it keeps getting worse, intensifying over time, becoming increasingly debilitating. If it's especially bad in the morning, perhaps even waking you up, or worsens significantly when you cough, strain, or bend over, it's time to pay close attention to these warning signs. The key is change. A headache that's distinctly different from your usual pattern in terms of intensity, location, or accompanying symptoms. And crucially, it doesn't go away, despite your usual remedies and rest. Our bodies send signals. They're constantly communicating with us. Don't ignore a headache that feels off, that raises a red flag in your mind. If it lingers for weeks, becoming a constant companion and just feels wrong deep down, that's your cue to act, to seek professional medical advice. Listen to your body's red flags. They're there to protect you. Vision changes can be subtle. Blurriness, double vision, or trouble with your peripheral vision. Maybe you're bumping into things or squinting more than usual. These shifts often happen slowly, so it's easy to adapt and ignore. But if your sight just isn't what it used to be, or you're seeing things that aren't right, don't brush it off. Your eyes are a direct window to your brain's health. Notice the changes. Don't just adjust to them. Feeling off balance or unusually clumsy. It's more than just being tired or distracted. If you're suddenly unsteady, reaching for walls, or struggling with coordination, something could be up with your brain's control center. Persistent balance issues aren't just a phase. Don't write it off, especially if it's new and sticks around. Your body's foundation shouldn't feel shaky. Cognitive or personality changes are a big deal. If you or someone close to you notices you're more irritable, forgetful, or just not yourself, pay attention. Struggling to focus, forgetting words, or feeling mentally foggy can all be signs. These shifts are easy to blame on stress, but if they're persistent and out of character, don't ignore them. Your brain's personality center could be affected. Take these changes seriously and talk to a doctor. Seizures are a major red flag, especially if you've never had one before. They aren't always dramatic. Sometimes it's just staring off, twitching, or odd sensations. A tumor can disrupt your brain's electrical signals, causing these glitches. Any new, unexplained seizure, big or small, needs immediate medical attention. Don't wait or try to explain it away. It's your brain's way of demanding help. Sudden hearing loss or constant ringing in one ear, especially if it's unexplained, can be a sign of a brain tumor. Tinnitus that won't go away or trouble hearing on one side isn't just aging. Tumors can affect the nerve connecting your ear to your brain. If you're always asking people to repeat themselves, don't ignore it. Get it checked out. Persistent nausea or vomiting, especially in the morning, can be a sign of increased pressure in your brain. If you wake up queasy for no clear reason and it's not a stomach bug, pay attention. This symptom is easy to dismiss, but if it's ongoing and paired with headaches, it's worth investigating. Notice the pattern. Don't just chalk it up to stress or diet. Your body's trying to tell you something. Sudden weakness or numbness, especially on one side of your body, is a serious warning sign. If your arm, leg, or face feels heavy, weak, or numb for no reason, don't ignore it. This could mean something is interfering with your brain's control of movement. It can look like a stroke, and either way, it's an emergency. Seek help immediately. Trouble speaking or understanding words isn't just being tired or distracted. If you can't get words out, can't understand others, or your speech is suddenly slurred, it's a big deal. These issues often point to problems in the brain's language centers. Communication struggles are isolating and important to address. Don't be embarrassed, get checked out. It's a critical clue about your brain's health. We've covered a lot of ground in this discussion, haven't we? We've explored some complex topics, and hopefully, you're feeling more informed. But the goal isn't to instill fear or anxiety, it's to promote awareness and empower you with knowledge. Early detection truly changes everything, offering the best chance for successful intervention. And remember, you know your body best. You're the expert on your own health. Medical treatments are improving all the time, constantly evolving and becoming more effective, with new therapies being developed and refined, offering hope and possibilities, leading to better outcomes and improved quality of life for many. So if any of these symptoms sound familiar to you, and they persist or won't go away, don't ignore them. It's crucial to talk to a healthcare professional and share your concerns. In most cases, it's probably nothing serious, but knowing for sure is always better than living with uncertainty and worry. Thank you for watching and for being a part of this important conversation about health and well-being. If you found this video helpful or informative, please subscribe to our channel and give it a like. Remember to take good care of yourself, prioritize your health, and stay safe and informed.